Okay, we're going to be looking at cancer now. We'll talk about malignant tumors of the cervix, uterus, and ovaries. So, carcinoma of the cervix, carcinoma of the uterus, or ovarian cancer. Sometimes we'll say cervical cancer, uterine cancer, and ovarian cancer. So, carcinoma of the cervix, most cases of cervical cancer, these are caused by an STD known as HPV, right? Human papillomavirus infection. It is a sexually transmitted disease. Okay, that's important to know. Most of the cases of cervical cancer are caused by an STD called HPV. There are vaccines that now exist against some of the causative strains of HPV. There are hundreds of strains of HPV, but very few of them are high risk, and that could lead to cervical cancer. So they try and isolate those strains for the vaccine. Routine pap smears of the cervical cells are very important in identifying early and then to treat the different stages of the disease. So when should a pap smear be done? It's called pap, named after George Papanicolaou, the physician, by the age of 20 or in the year that sexual intercourse begins. This is a pap smear. All of the brown spots, these are abnormal staining and abnormal cells. Okay, carcinoma of the cervix. Early dysplasia of the cells, right? Abnormal cells that are showing less differentiation. That's what dysplasia is. Cervical intraepithelial neoplasia can be graded from 1 to 3. Grade 3 is considered carcinoma in situ, and it takes many years to get to this stage. Invasive stage of cervical cancer, it spreads in all directions. It can lead to cancer of the uterus, the vaginal area, the bladder, the rectum, anything that's adjacent to it, the cervix can spread to. And in the late stages, it can lead to metastasis. So we have normal, right, squamous cells in the transformation zone of the cervix. Then these normal cells are exposed to an irritant or to a carcinogen, and that starts to change the DNA, and now it leads to mild dysplasia that can lead to severe dysplasia. After mild dysplasia, that can be detected by a pap smear, and it's important to remove the irritant at that stage or the carcinogen, or try and repair the DNA. Then, if not, and it progresses, now it's severe. That's from additional exposure to these carcinogens or a viral infection like an STD. Now it starts to advance to a neoplasm, a malignant neoplasm, where we have the proliferation of these undifferentiated cells. Then that can become the carcinoma in situ, where we have this superficial, small, it's localized at the site, and it can remain there for years, and then that can become an invasive carcinoma, where you have decreased cell adhesion and invasion of the local tissues and lymph nodes, right? Then it can metastasize. So in terms of the carcinoma of the cervix, a cervical cancer, the etiology could be many as sexually transmitted diseases. Herpes simplex type 2 can cause it, and these are the difficult strains of HPV, 16, 18, 31, 34, and 45. The risk factors, cervical cancer is strongly linked to the HPV virus, strongly. Having multiple partners puts an individual at high risk. Sexual intercourse beginning at early teenage years is a major risk factor. Smoking and history of other sexually transmitted diseases. Now, it doesn't have to be all of these. It could be multiple partners, and smoking puts you at high risk. It could be, STDs and being HPV. That alone puts a person at high risk. And that's why it's important for the pap smear to actually look and identify what type of strain it is. Okay, this is carcinoma of the cervix. Treatment is going to be surgery or radiation of cervical cancer. Now let's look at uterine cancer, carcinoma of the uterus, also known as uterine sarcoma or endometrial carcinoma. So this is most common in women in menopause, so postmenopausal women. The early indicator, painless vaginal bleeding or spotting. Okay, that's really important to know. That's an early indicator. Painless vaginal bleeding and or spotting. The risk factor, women over the age of 50, and high-dose estrogen hormone treatment without progesterone. So this tends to be one of the triggers is estrogen replacement therapy that women use. Obesity and diabetes, together we sometimes refer to this as diabesity. Okay, obesity and diabetes, also big risk factors. For carcinoma of the uterus, pap smear does not detect this cancer. This one is not linked at all to HPV. This usually arises from the glandular epithelium. The malignant changes occur from the excessive estrogen stimulation and the development of hyperplasia. It's pretty slow growing, but it happens to be invasive. Again, surgery and radiation. Okay, carcinoma of the uterus, this one's not related to an STD. It's not HPV related, but cervical cancer is. That is carcinoma of the uterus. Now, ovarian cancer. And there's different types. They vary in their aggressiveness. The serous one is the majority of the malignant cases. Then there's mucinous and endometrioid. So serous, mucinous, and endometrioid. The majority of the malignant ones are serous. Diagnosis, there really is no reliable screening process for this one. It's just a large mass is detected by a pelvic exam. Some of the other diagnostic methods, there's transvaginal ultrasound, CAT scan, MRI. So these are all, this is pretty invasive stuff. And then the blood test, looking for a specific protein marker, the CA125. That's a protein seen with ovarian cancer. The risks, obesity, the BRCA gene, BRCA1, that's often seen with breast cancer as well. Early menarche, early first menses, not menopause, early menarche. Nulliparous, or a very late first pregnancy in life, and the use of fertility drugs. Ovarian cancer is considered a silent tumor, few diagnosed in the early stage. When symptomatic, there's bloating, indigestion, urinary frequency, there's a backache, and painful intercourse. Again, surgery and chemotherapy with this. But so the ovarian cancer, this one is considered a silent tumor. They don't really create many issues in the very early stage, and that's why very few are diagnosed early on. Silent. When we come back, we'll talk about infertility and some STDs.